Welcome back to the channel. I'm Michael Neuenschwander with Outlook Wealth Advisors. In today's video, we're going to talk about how to address the expenses or the cost of healthcare or medical care in retirement. Now, if you've joined us in previous videos, you may have seen the video where we talked about all the different risks you need to address in retirement, beyond just simply the investment risk that most people think of. So if you didn't get the chance to catch that video, you can go back and look at things about long-term care, about asset protection. But for today, we're going to focus on the healthcare side of those risks and costs in retirement. And we can break that down into a couple of different areas. We've got pre-65, health insurance. Well, now, for many of you, fortunately, you may be covered by your employer. So non-issue. One of the questions that sometimes comes up, though, is, well, if I'm turning 65 but still working, do I need to go run out and sign up for Medicare? Because I've heard there's a penalty if you don't sign up on time. Well, unfortunately, that question is going to say, double check with your current employer or health insurance. If you're with a major company, you probably don't need to do anything. You simply stay on your current health policy until which point you retire, and then you need to switch to Medicare. However, what about people who are no longer working and still need care? In today's environment, the Affordable Care Act, going to the exchange, is what most people have to rely on. But the exchange can be complicated, and when it comes to looking at your overall retirement picture, here's the part that many people either miss or don't understand exactly how the pieces fit together. What you pay on the exchange is determined by the rest of your income. So if you need medical insurance pre-65, but your only choice is to take money from retirement accounts to both pay the medical premium and live on, depending on the level of your lifestyle or your expenses, you may be forced to pay thousands of dollars per month for that pre-65 medical insurance. On the other hand, if you have a strategy that it says you have non-retirement money, you have some other sources to rely on, even if it's just for a couple of years, you may only be paying a few hundred a month for that Affordable Care Act coverage instead. So in looking at health care via the exchange, it's important to understand not just are you looking at the health care, are you looking at your overall retirement picture to understand, is there a way you may potentially save yourself thousands a month by making sure you're taking your money from the right places, even though your primary concern for today's video may have been healthcare expenses. But after 65, then you have a whole nother list of choices. Medicare, Medicare Supplement, Medicare Advantage, which is the right way to go. So if we start off with the basics, Medicare, to give you a general idea, in today's environment, Medicare costs about $180 per month. Medicare Supplement is going to be right in that same area. And then your Medicare Part D, your prescription, is also going to be in that $50 to $70 range, depending on the choice you pick. So for a couple, today, you still need to budget about $800 a month simply going towards Medicare, Medicare Supplement, and your prescription plan. And of course, those numbers are indexed for inflation, so while it may be $800 today, it's probably going to be more expensive in the future. So after age 65, the primary sources of healthcare coverage, though, become Medicare, Medicare Supplement, or Medicare Part D, the prescription side. Well, hold on, Michael, what about Medicare Advantage plans, or what are called Medicare Part C? Now, as you approach 65, you're going to hear all about them because you're going to get tons of stuff in the mail. What Medicare Advantage really is it's a partnership between Medicare and between that insurance company or that group. Behind the scenes, Medicare is giving some additional money to that group, and the idea is that they're supposed to cover everything that Medicare and Medicare Supplement was going to cover. However, the primary advantage, if we look at Advantage plans, is they are a little less expensive. Typically, that extra roughly $180 per person that would go towards Medicare Supplement, you don't need to pay that. In essence, that's where the Advantage comes in. So if we compared the two, regular Medicare, Medicare Supplement plus a prescription plan may typically run a couple about $800 a month or $400 per person. The Advantage plan saves you approximately $180 off of that, or roughly $360 per couple. Both of those, however, there's an extra little caveat that comes in, says both of those, the real amount you pay is determined on your income. There's another nasty little thing in the tax code called IRMAA, which says the higher your income, the more you have to pay for your medical coverage. And there are certain things that are exempt from income. There are certain planning strategies to try to make sure you stay below those thresholds. So if this is an area where you have questions, or if this is an area where a current advisor or a current person isn't telling you how this works, there's definitely some gotchas, built into the system. So you may need to be talking to somebody that has a little bit more knowledge or at least a little more expertise in addressing how these pieces fit together. However, the other part of healthcare and retirement that really is not addressed by Medicare, Medicare Advantage, or the Affordable Care Act is the long-term care side of things. When somebody is at the point where, in essence, they may not get better, it's unfortunately a condition that will simply continue to get worse. That kind of care is not covered by Medicare, Medicare Supplement, or Medicare Advantage. In a separate video, we've talked about the 4 different ways you can address planning for long-term care expenses, but make no mistake, that can be a very large expense and needs to be addressed as part of your overall healthcare strategy in retirement. So if this topic was helpful for you, or you want to get more information on the various ways to address the long-term care expenses, make sure to subscribe to the channel or watch the video specifically about long-term care.